Mental health, addiction, and technology. 5 years ago wasn't really the time to introduce something like this into the system. Even 3 years ago wasn't really the time. But now, because of changes in healthcare, legislation, and the physical health, mobile health technology leading the way, it is. But only if it's done right. Our system is completely overburdened and overwhelmed. We're seeing more clients hit the system almost every day. There are less providers to actually provide the care. There's a lower reimbursement for that care provided, and the system is having serious issues. All while the federal government is asking metrics to be met, like the triple aim, which wants to see better care, better access, and lower costs. So let's stop and think. 88 million people, that's a staggering number. That's a quarter of the United States population who struggles on a daily basis with mental health and addiction issues. And the scary thing is not all of them get care, even though they ask for care. $231 billion a year is what's spent on that care. I got an email this morning from one of my classmates who actually said it's 280. Why do I know this? I worked for 16 years in this system. I built programs, I managed supervised programs, and I continue to advocate by sitting on councils, committees, steering groups, and delegation teams. We built the system KnKt'd to help ease the burdens of this major issue that's going across the United States, and actually the world. So the system takes information that comes in from the provider app, and it aggregates that data and color codes it using a Likert scale. So a clinician can get instantaneous data, log into the system, see how their clients are doing, and act accordingly. They can also dig deeper into the system if they want. It's HIPAA compliant, it's based off of evidence-based practices, and it costs under $2 per month that the clinician can actually bill using customary and usual billing rates. But they can also use this system, as you can see, to look at who's struggling and fit those people into schedule appointments later on in the day. We built the app to be just as easy. The patient sits down with the provider to decide what it is they want to track. It could be mood, sleep, appointment reminders, medication reminders, treatment goal tracking, and then they head out the door, and we do the rest. KnKt'd uses push notifications, no different than Facebook and Twitter, to alert the end user to answer the questions. I run the system myself, and in the morning, answering 3 modules worth of questions takes me under a minute. It's truly providing care on a daily basis. So we market in a lot of different ways, but the most important ways that we market is the provider advocate model and case-based selling. That means that they are our strongest voice, and they speak for us and to other people who provide care, which brings more people in the door to use this solution. So first thing is this, is we are revenue positive. In fact, we have 6 companies using our system. So when you look at that number up behind me that says 6, that means that's 6 companies with multiple providers and hundreds of potential patients. By the end of this year, we hope to close with 10 companies and add another 15 more in the first half of next year and another 30 before we close 2017 off. And we market after universities, hospitals, outpatient providers, and private clinicians. How do we compare to the rest? Well, first of all, it's very important that everybody in the system is trying to solve this problem. But our competition really doesn't have a solution to help the system out. And so what we're seeing is that a lot of their people are coming to us and staying with us because we have an intimate knowledge of the system because we worked in it. And we built the system to each one of those key metrics. So where are we headed with our funding? So when we bring in our $750,000, we're going to bring on 2 salespeople, 1 marketer, and 1 operations person. because they're going to help us continue to bring people in. We've bootstrapped till now until we came to this phenomenal program called Health Wildcatters. And with that extra $750K, we'll be able to continue to increase the providers in the system, hopefully hitting our own milestone of $1 million in our first year, and 150 providers using the system by middle through 2018. And we'll be increasing the price twice as we add more things to the system in version 2 and 3. I could be really biased, but this is an amazing team, and this is the team for the job, because they have an intimate knowledge of the system, like I said, but they're also top in their field, and so they're helping us lead the charge. We're proving each and every day that we are a solution for the system, a tool to intervene, a tool to prevent, and a tool to save lives. And the funny thing, at the same time, we're showing that we can reduce the costs and increase the revenue. It's kind of mind-blowing if you stop and think about it. We're also showing that we're a highly adaptable system that can flex and grow with the national behavioral health scene as new things come in, because all we do is develop a new module and we plug it into the existing system. When 88 million people are struggling in the United States, it completely changes the conversation. And we should change the way that we provide care. And we should be connected. And just like patients need to be connected, and clinicians do, we need to be connected too. So we ask that you introduce us to investors and partners and other people that could use the system to benefit both parties. I'm Matt Holland, KnKt'd Behavioral Health.